In Uganda, deaths of newborn children account for 50% of all infant deaths. Among the most vulnerable are children who weigh less than 2.5 kilograms compared to the average weight of 3 kilograms for average newborn babies. Of course, all babies are small, but it can be difficult to realize a baby is at risk if you can't actually weigh him or her. Babies born in hospitals are routinely weighed, and ones with low birth weight are introduced immediately to the home care practices they need to thrive. But low birth weight babies aren't identified so easily when their mothers deliver at home or in lower level health facilities. In our feature today, we visit Iganga village in Eastern Uganda, and we talk to a doctor who has devised a simple tool that can help mothers who deliver at home know if their children are of low birth weight and hence need special attention. I am Winnie Onyimbo for Trans World Radio. Dr. Nabiwemba Elizabeth is a lecturer at the School of Public Health in Makerere University in Uganda. Together with Dr. Peter Waiswa, they have come up with a foot measuring card that shows at a glance whether a newborn is above or below the required birth weight. I visited her in her office in Makerere campus in Kampala. I started by asking her why she is interested in the birth of newborns.
The interest in these children was due to the fact that neonatal mortality rate has been stagnant for the last close to 20 years. And it is at a rate of 27 per 1,000 live births. And it's not going down at all, although the infant mortality rate is reducing and the under 5 mortality rate is reducing. So we wanted to find out what the cause of mortality among these newborn babies is. And we found out that low birth weight is a very key risk factor, and most deaths are actually associated to it. But the problem was that many of these babies were not identified early because interventions that help these babies survive are known, and these are majorly to keep the babies warm, to make sure they are well fed, and to prevent infections by maintaining good hygiene. But many of the babies are not identified early, so that we can't reach them with interventions, and therefore they end up dying. The reasons are majorly two. Nationally, about 40% of babies are born at home, and this has actually decreased of recent. It was as high as 60%. And when the babies are born at home, there is no access to a weighing scale, therefore they are not weighed. But even among those that are born in facilities, a good proportion are not actually weighed. And this is either because they don't have a weighing scale, or it is faulty, or the workload is too much for the midwife and she ends up not weighing the babies.
One of the areas in Uganda where the foot card is being used is Iganga district in the eastern region of Uganda. This is also where Dr. Elizabeth conducted her tests on newborn children. I visited the area and talked to women living 10 minutes apart in 3 different villages. Each of the women had either lost or is bringing up a baby who was born premature. Such cases are common in Iganga area, where many women give birth before they reach the age of 18. Shandi Mwamadi, for instance, conceived and lost her first baby when she was 17 years. Now she's 18. She's nursing her new baby, who is less than 1 month old. She's quiet and reserved and lets her husband do most of the talking. Her husband explained to us what happened the day the baby was born.
It was at night on my bed. I was sleeping. I start to hear my wife crying. I said, what happened? I said, I'm not feeling okay on the stomach. Then it was crying. It was not yet the month. to bring that baby out. It was at night around, 10.
You were alone with her?
Yeah, I was alone. It is difficult. He came out up to this way. For me, I just bring my hand and put it there and bring the baby out. Yeah, I do kangaroo, and even myself and even my wife. And after, for me, my wife is putting on kangaroo, then it was during the day for me at night. When I come back for a job, I put here, I sleep with my baby.
Because the baby was born at home, a community health worker was quick to attend to the baby, using the foot measuring tool to ascertain whether baby was within normal weight range. Hospitals in Iganga are few and far between, and sometimes do not have working weighing machines. Community health workers bridge the gap between the doctor and the community by checking on the new mothers, as well as offering health tips that they have learnt from the district health office. Dr. Elizabeth trained the community health workers how to use a foot measuring card, which they carry whenever they are visiting a home with a newborn. But how is a card used? Dr. Elizabeth explains.
So after realizing that many of the babies are not weighed, we wanted to come up with a simple, easy to use tool that can be used by even people in the community that do not have any medical training. And we wanted to find something that is easy to handle at the community level, that will not need scaling and maintenance. So in my study, I tested a number of anthropometric measurements to come up with one that is most accurate in screening for low birth weight. Among the measurements I used was mid-upper arm circumference, head circumference, thigh circumference, chest circumference, and foot length. And in the analysis that we did, it showed that foot length was the most accurate, most sensitive measure for low birth weight. So we came up with a card which has a print of a foot measured to up to 8 centimeters. And if the village health team worker puts the footprint of the baby on that card, they are able to tell whether it is below or above the line, the mark. And if it is below the mark of 8 centimeters, then this baby is suspected to be low birth weight. And the baby is referred to a hospital so that the mother is helped and taught on how to manage these babies.
And back to Iganga. Shandi's baby came 4 months earlier than her expected birth date. She weighed 1.1 kilograms. In Africa, chances of survival for a baby born below 2 kilograms are very low. Most will die within less than a week after birth. Shandi's husband rushed her to hospital when the baby was born, and a week after, mother and daughter were discharged. Now a community health worker checks on the baby every week to ensure that she is feeding and gaining weight as required. She still looks very small and is constantly in the kangaroo position on her mother's chest. But Shandi's baby is going strong a month after she was born. Today, Joseph Isabirie, the community health worker in Shandi's village, has come to check on the baby. And one of the things he will have to do is use a foot measuring card on the baby. Let's listen in.
You know, you have to keep hygiene. Before touching the baby, you have to wash our hands. That's why I'm washing my hands. This is a foot measuring card. We use it to measure children. The one who has normal weight, this foot has to be above this red color line. So that means this one is underweight because the foot is in between the black line and the red one. When you measure, you have to start from this black line, then you go up. When the foot is in between, that means the baby is underweight.
Dr. Elizabeth acknowledges that there may be some margin of error, especially when a child is either very tall or very short, depending on his or her genes. She therefore advises the mothers to always have their children checked by a doctor in their next clinic appointment. And she explains the steps to take if a child is found to be below the required birth weight.
We use it as a screening tool, and for all screening tools, it has a level of accuracy. The foot length card we are using has a sensitivity of 85%, and that means that at least 15% of the babies may be misclassified. Some babies may be genetically tall with a long foot, and therefore you may think that they are normal weight when they are actually low birth weight, while others may be genetically short, and it will give an impression that they are low birth weight when they could be normal weight. So it is only a screening tool, and we always refer the babies for confirmation to a facility. When a baby is identified as low birth weight, if it is in the community, they are immediately referred to hospital. In the hospital, the mother is required to do majorly 3 things. One of them is to keep the baby warm, and this we are doing by the Kangaroo Mothercare, where the baby is put in the mother's chest and tied with a piece of cloth, so they are kept close to the mother, and therefore get the heat from the mother to keep warm. Or they are also encouraged to dress them with a cape, in warm clothing and socks to make sure they are warm. We also encourage the mothers to feed these babies. Some of the low birth weight babies, especially if they are preterm, may not be able to suckle on the breast. So mothers are told to express milk and feed the babies with a cup and a spoon, and also feed these babies on demand to ensure that they'll be able to gain weight. We encourage mothers to maintain hygiene, do hand washing with soap before touching the baby, before feeding the baby, making sure the baby is clean to avoid infections. We teach them how to clean the cord, make sure it is kept clean without adding anything, so that we avoid infections, for we know that these low birth weight babies are very prone to infections. And when the mother does all these things, the baby has very high chances of survival.
Recognition of low birth weight is still very poor in Iganga. Many mothers don't consider low birth weight to be a danger sign in newborns, and thus rarely seek health care. Even some mothers who initiate good care practices for low birth weight newborns in the health facilities like Kangaroo Mothercare and Exclusive breastfeeding do not sustain the practices at home and subsequently lose their babies. Clearly, determining the weight of the baby using the foot measuring tool is not enough. Mothers need health education to increase their knowledge of good care practices. That means village health teams that reach into the community play a crucial role, helping young mothers like Shandi ensure the survival of their little ones.